Okay, you're in a quiet room and you hear ringing or buzzing and nobody else can hear it. We call that tinnitus or tinnitus. And for most people, it's barely noticeable, but for others, it can be a big deal and affect their quality of life. So let's talk about what causes it and what you might be able to do to treat it. So tinnitus starts with nerve damage to the inner ear, those little hair cells, but the ringing isn't actually coming from your inner ear. They found that it's actually coming from your brain. Your brain tends to compensate by increasing its own internal volume. And so that abnormal activity is perceived as buzzing, ringing, chirping, other strange noises. So think of it like a phantom limb pain, but for hearing. So what damages those little cells is actually noise. By far the most common problem is noise exposure that you've had through your life. Aging can contribute, some genetics, and then certain medications are implicated as well. Now, tinnitus will affect people differently. Again, some barely even hear it. Others, it's a big deal. It affects sleep, work, relationships, mental health. So when should you get checked? If it's severe enough to affect your quality of life, don't try and tough it out. You should be evaluated for that. Other red flags are tinnitus that's just on one side. If it's associated with a pulsation like your heartbeat, if there's a loss of hearing just on that one side as well, dizziness, other neurological symptoms, you should have evaluated sooner. It can indicate a tumor potentially on one of the balance nerves or even the vascular structures in the brain. So what can you do about it? Step one, you got to get a hearing test. That can be through an ENT office or an audiology group. It helps us determine the type of hearing loss, the severity, and helps guide our management. And then there's kind of a toolkit of 5 things that we recommend. First is lifestyle factors. Stress is huge. That affects everything, makes tinnitus so much worse. So exercise, relaxation, mindfulness can be helpful. The second thing that's recommended is cognitive behavioral therapy. Actually has the most data behind it. CBT helps retrain how you respond to the tinnitus. It helps reduce the distress, improve your quality of life. This can be done in person, of course, but in group sessions, even online, believe it or not. Third thing is sound therapy, probably the most common thing that we do, masking. You put white noise or nature sounds around you, and it helps kind of decrease the intensity of the sound that you're hearing. Evidence shows it works best with CBT as well. Fourth thing are hearing aids. If you got some hearing loss, helps with that, but also actually can help diminish the intensity of the tinnitus as well. And then the fifth thing is called bimodal neuromodulation. For people that have moderate to severe tinnitus that don't respond to the other classic treatments, it's actually FDA approved and kind of helps retrain the brain to focus on other things instead of the tinnitus itself. So if tinnitus is affecting your life, see an ENT. Most people improve significantly with time and management. Now you knows, follow for more.